Reach your arms overhead right now, all the way up. Did your shoulders come along easily, or did something pull and resist? That pulling sensation is not just stiffness. Researchers are finding that it may be one of the quiet signals your body sends about how it is aging from the inside out. A 2024 study followed more than 3,000 adults over nearly 13 years. After accounting for age, body weight, and overall health, people with low whole body flexibility scores had a substantially higher risk of dying during the study period than those who scored high. The researchers described it as a correlation, not proof that stretching makes you live longer, but it was a striking enough signal to take seriously. What that study suggests is that flexibility is a window into broader biological aging, and the good news is that it is one of the most trainable things about your body at almost any age. Today, we're going to look at what the science actually says, what a practical 10-minute daily habit looks like, and who needs to check with their doctor before starting. A lot of people think of flexibility as a fitness vanity metric. Can you touch your toes? Can you do the splits? That is the wrong frame entirely. Here is what the research connects it to. First, your arteries. A 2009 study found that in middle-aged and older adults, specifically, poor trunk flexibility was associated with significantly stiffer arteries. People with low flexibility had arterial stiffening that was roughly 30% greater than those in the high flexibility group. A 2024 systematic review and meta-analysis confirmed that association across multiple studies and different populations. Stiff arteries make the heart work harder. Flexible arteries are gentler on the cardiovascular system. Second, joint range of motion shrinks as we age by roughly 6 degrees per decade after 55. That is driven by real physical changes. Tendons and muscles get stiffer, collagen production slows, and connective tissue changes. The practical result shows up in daily life: reaching something on a high shelf, getting dressed, turning to look over your shoulder while driving. These are not trivial things. Third, fall risk. The muscles most involved in gait stability, calves, hamstrings, hip flexors, are exactly the ones that tighten with age. Tight hips and ankles change how you walk and how quickly you can correct your balance when something goes wrong. None of this requires dramatic flexibility. You do not need to be an athlete. You need enough range of motion to move through daily life safely and with confidence. Here is something worth repeating, because most people do not believe it. Measurable gains in joint range of motion can show up in as little as 3 to 4 weeks of regular stretching, according to the American Academy of Family Physicians. A randomized trial on adults aged 60 to 65 found that stretching for 30 to 60 seconds produced significant improvements in hamstring range of motion, and those gains were still present 24 hours later. Another trial, this one with retirement community residents whose average age was nearly 89, ran a stretching program twice a week for 8 weeks. Range of motion improved for most joints tested. Functional performance improved across the board. The control group, who did not stretch, showed no improvement at all. Nearly 89 years old, meaningful gains, 8 weeks. The American College of Sports Medicine and the National Institute on Aging are both consistent on this point. Any amount of flexibility work is better than none, even if you are not hitting the full recommended dose right away. The American College of Sports Medicine recommends stretching all major muscle groups at least 2 to 3 days a week, with daily practice preferred for the best results. A 10 to 15-minute daily session can cover the areas that matter most: calves, hamstrings, hip flexors, chest, shoulders, and neck, the groups most connected to posture, gait, and fall risk. Here is what that can look like in practice. Start with 3 to 5 minutes of light movement, walking in place, gentle arm circles, or shoulder rolls. This warms the tissue before you ask it to lengthen. Then move through 6 simple holds: a standing calf stretch against a wall, a seated hamstring stretch with a neutral spine, not a rounded back, A hip flexor step back, 1 foot forward, rear knee lowered gently toward the floor. A chest opener, clasp your hands behind your back and gently lift. A slow neck stretch, chin toward the chest, then a gentle side-to-side rotation. And a trunk side bend, reaching one arm overhead. Hold each stretch for 30 to 60 seconds. That longer hold time matters for older adults specifically. The ACSM recommends it to counteract the greater tissue stiffness that comes with age. Aim for 2 to 4 repetitions per muscle group. The sensation you are looking for is mild tension, a light pull, never pain, and keep breathing, slow, relaxed breaths throughout. One more thing, do your static stretching after activity or as its own session. The evidence no longer supports holding long static stretches before exercise. And avoid bouncing. That rapid movement increases injury risk in older connective tissue. Most healthy adults can begin a gentle stretching routine without any special clearance. But there are a few situations where talking with your doctor or physical therapist first is genuinely important. If you have had a recent joint replacement, hip, knee, or shoulder, your surgeon's protocol likely restricts certain movements during healing. Follow that guidance before following any general recommendation. If you have been diagnosed with osteoporosis or low bone density, some common stretches carry higher risk than most people realize. Deep forward bends from standing and spinal rotation taken to its end range can increase the risk of vertebral compression fracture in low-density bone. Safe alternatives include chest openers, gentle neck stretches, and hip flexor stretches that keep the spine in a neutral or extended position. A physical therapist can help you build a routine that works with your bone health, not against it. Stop immediately if you feel sharp or stabbing joint pain, numbness or tingling radiating down a limb, or any dizziness or chest discomfort. Those are signals to step back and check in with a clinician. There is a question worth addressing directly because you may be thinking it. Does stretching actually make you live longer? Or is this a case of one study generating more excitement than it deserves? That is a fair question. The 2024 Clinimex study is a correlation, and the authors say so plainly. Poor flexibility may be a marker of accelerated biological aging rather than a direct cause of earlier death. We do not yet know for certain, but here is what we do know with more confidence. Regular stretching is associated with reduced arterial stiffness. It preserves the range of motion you need to stay independent. It supports safer gait and better balance. It is trainable at almost any age, and 10 minutes a day is a genuinely achievable dose. You do not need to resolve the longevity question to make this worthwhile. The functional case, moving better, feeling less stiff, staying on your feet, is already a strong enough reason on its own. If this kind of practical, evidence-grounded approach to aging well is useful to you, consider subscribing. We add new videos regularly, and we try to keep every one of them honest, calm, and actually usable in real life.